Now let's talk about situations when a patient passes out. More specifically, it's known as a syncopal episode. Now, when a person passes out, it could be from a number of reasons, and many of those reasons do not have to be life-threatening. What we're really concerned about when a person goes unconscious is that they're unable to protect themselves from the fall. And if they can't protect themselves from the fall, there's any number of things that can go wrong. They can hit their head, they can hit their face, and they can even break bones. So when we come up to a person that has had a syncopal episode or has passed out, we still want to assess them for life-threatening conditions. We want to check them for the potential of having a concussion or a neck injury. Once we've ruled out those different possible side effects, we can begin to just see if the patient maybe just has a self-limited issue going on. They need to rehydrate, maybe they need to eat something, and they don't need to necessarily go into the hospital. So when I come across somebody who's had a syncopal episode and they're awake already, like in the case of this patient, she's beginning to respond. She doesn't necessarily feel all that well, but she's clearly gotten up to a sitting position on her own. Now we can kind of interview the patient and see what's going on. Hi, ma'am. My name is Roy. I'm trained and I can help you. What's going on today? She then responds back to me, I didn't feel well sitting at the desk and I started to get lightheaded. So I wanted to go and get a sip of water, but as soon as I stood up, everything went black. And that's the last thing I remember, and then I woke up on the floor. So there was no one in here to be able to watch her, so we have no idea if she hit her head or her face, and it's up to us to become a little bit more detective to find out if there's any potential injuries that need to be treated. So I want to ask her, did you have any headache, or how are you feeling? Do you hurt anywhere? She then shakes her head no. She says, I'm feeling okay other than just feeling kind of weak and dizzy. And so we then know immediately she's awake, she's responsive, she has a good airway, she's breathing, and she has a pulse. We're going to look at her skin, see if it's pink or pale, if it's dry or clammy or sweaty, and that could be a sign that she's still dealing with some of the shock symptoms and may be enough for us to say, you know, under circulation, this might be a bit of a compromise, and she's not feeling all the way well. Now is the time where I'm probably going to decide to err on the side of caution and activate EMS. Send a bystander, you in the plaid shirt, go call 911 and come back. If you can find an AED, bring it with you. Now, why did I say AED? Well, we have no idea what really caused her syncopal episode in the first place. Though it could be something simple as dehydration or a little sugar dip, we also might be dealing with a dysrhythmia of the heart, and we don't want to take that for granted. And so having an automated external defibrillator available in case she has another event or goes fully unresponsive is always a good idea. If she begins to recover, she doesn't have any pain, the concussion doesn't seem to be prevalent, or she seems that she's answering questions all fine, we can kind of work with the patient and allow them to begin to recover at will, at their own power. But if at any time we notice that they are decreased level of consciousness, have airway breathing or circulation problems, signs of shock, a long bone fracture, or they might be coming in and out of responsiveness, that's immediately going to be an emergency call. Activate EMS, call a code or call 911, and now we're going to treat her symptoms accordingly.